How can someone generally slow or even reverse that biological age?
That is the million-dollar question. Always starts with the consultation. I get to know you in the most traditional way of medicine. Do you want to look better? Do you want to feel better? Do you want to live longer? Do you want to be able to walk more than you used to?
So slow and steady is always better.
Slow and steady is always better. Absolutely.
There you go.
That's a loaded question. Because
it's a gift I have. Yes, I know.
Focus on prevention, focus on nutrition, and focus on exercise.
Well, hopefully some of them are listening out there. What if you could slow down your biological age, boost your energy, and actually reverse the way your body is aging without living in a hospital or taking a suitcase full of medication? And what if the doctor who once practiced deep inside Los Angeles's sick care system is now helping Miami Beach's influencers, socialites, and regular people optimize their lifespan and health span? Today, you're going to meet that physician behind one of Miami Beach's most advanced longevity and regenerative medical clinics, where stem cells, peptides, Ozempic-style metabolic support, and deep diagnostic testing are all under one roof. Welcome, friends. I'm Marty Davis, a business lawyer, entrepreneur, connector, and your host. On this episode, we're jumping into one of the hottest topics on and off YouTube: longevity, biological age, and regenerative medicine. Not to mention what it takes to build a premium wellness brand in Miami Beach from the ground up. We're filming today from Global Furniture Group in their beautiful showroom in the Design District in Miami. It is a wonderful opportunity to see what innovation can bring to commercial furniture, to commercial accessories, and that for education, healthcare, and general office use. They're real innovators, and what an opportunity. Thank you so much for allowing us to film here. Our guest is Dr. Alonzo Martin, founder of Body Well, a physician who stepped down from traditional sick care medicine to create a data-driven, luxury longevity practice serving everyone from local families to international socialites. Dr. Martin, welcome to the show.
Marty, thank you so much for having me here. It's such a pleasure.
Well, great. For people who are meeting you for the first time, how do you describe yourself? A doctor, an entrepreneur, a builder in Miami Beach?
I think all three of those things definitely describe who I am. I like to think of myself as a wellness physician because early on in life, that's exactly what I wanted to be. I wanted to be a doctor that helped everybody, that wanted to save the world, and that wanted to help people really detect disease early and really prevent illness from happening. So I do describe myself as a wellness physician. I care deeply about community and social connections. So oftentimes in my practice, we foster that environment where we host events for yoga and puppy adoption and many other events that brings and ties the community together to really help them thrive in their individual lives.
Great. So you're looking at a whole system of wellness in your practice.
Yes,
Very
absolutely.
Good. Well, you went from working in other people's offices to opening your own practice here south of, well, you're not south of 5th. You're north of 5th.
North of 5th now.
And you're by the Whole Foods now on Alton, right? Mm-hmm. And Body Well.
Body Well.
Very good. And walk us through the leap from employee to building your own business.
Sure. So I started my career, like you were mentioning earlier, in community clinics. Working in those community clinics in Los Angeles really taught me a lot about really what medicine should be and what it is not. So medicine needs to really transition from a sick care model where we diagnose and assign a certain medication or a certain therapy to that diagnosis and really be more proactive when it comes to prevention and early detection. And when I moved from that model in Los Angeles to Miami, I worked for different companies that were more focused on prevention and were more focused on regeneration. And so I really took my skills to a whole nother level. And I became more inspired by the way wellness and interventional medicine was done here in Miami. So that led me to eventually open my own practice and really bring all of that together, the Western disease-based model to more reversing of diseases and prevention of diseases and really optimizing of health.
Great. Nobody wants to be in the hospital or in a doctor's office because they're sick or have a problem.
Yeah.
So why not nip it in the bud, so to speak, right?
Yeah, absolutely.
Very good. I've lived in South Florida all my life, and Miami Beach is full of med spas and wellness trends. But you've said that there is nothing like your clinic on the beach. What gap did you see, and how are you filling that gap, and what sets you apart?
Great question. So when I moved here from California to Miami Beach, I looked for a place where I could go myself and have diagnostic workups, have a vitamin shot or an IV, or even have some Botox or a laser. And really, there was nothing on the beach that really met the standard of care and the standard that I was used to coming from California, which has always been known as the wellness destination, as where people are healthy and very proactive. So I didn't see that in Miami Beach. And my dream was to eventually open up something like BodyWell, where we not only provided medical services, but also created and curated an experience for patients from the moment they walk in to the moment they sit down, check in, and enter the treatment rooms. And so just like the Four Seasons, where they built their empire on luxury and client experience, I wanted to bring that touch to Miami Beach and be able to offer that to everybody, no matter where you live or what kind of medical institution you're used to.
I like that term, created and curated. You've established it and then you're following through, which, like the Ritz-Carlton or the Four Seasons model. So that's wonderful. Your patients range from influencers and socialites to the local residents there. You're not just treating the uber wealthy, you're treating everyone, right?
Right. Absolutely.
Very good. And how did you build that mix in your particular area where you're curating and creating?
I like to think of, me sort of building on my experiences in medicine and also my interests, which have been lifestyle most of my life, exercise, activity, surrounding myself in positivity and gratitude. And I transferred that to my team. And now my team, a very well trained team, sort of has that same vision and philosophy. And so it really is a team approach, because from the moment someone walks in, they're greeted. They're offered alkaline water that's also hydrogenated and reverse osmosis. So they start sort of the experience of optimizing their hydration, detoxification from the moment they walk in. So it really takes a team approach to be able to cater to the uber wealthy, the locals of Miami Beach, and also even the housekeepers that accompany the uber wealthy. Oftentimes we have patients who bring their housekeepers or their nannies, and they also receive treatments. So I find beauty in everyone. In every life, there's beauty. In every person, there's beauty. And when I'm at the bedside or, in the treatment rooms with them, I treat everyone the exact same way. And I think that's really what sets me apart from maybe other medical spas or other wellness centers, is really that humanistic touch that I've started as a child, then developed in medical school, and then in residence, and then in practice of community clinics.
Well, our viewers, I want you all to know I'm a before picture. So I'm going to start at the clinic, and you will be able to see how great I look and feel after I've been there a while. It could take a while, so stay tuned. But I'm excited to be curated. So you had a classic dream, doctor. You went to medical school. You wanted to help people. But early on, you knew you didn't want to spend your life just prescribing pills. Take us back to those days in Los Angeles. What made you realize that sick care wasn't your path?
Those days were the early days of my career, where I was freshly out of med school and residency, and I was eager really to make a difference, to really give back to the community that brought me up and inspired me about what medicine could be. And so those early days, really, I was so hyper-focused on patient care and really giving back, in the way that I was able to, meaning as their physician and as providing care. Many times I worked long hours and I was, limited sometimes to 10 minutes per appointment or 15 minutes.
Yeah.
And I had to address so many medical conditions, oftentimes also mental health conditions, which there's, a great need for. And so those experiences really taught me the value of hard work, dedication, and commitment to something. And all along, I always wanted to talk to patients about nutrition and exercise and social engagements and community engagements and eating, because eating is such an important part of health, and also sleep and recovery, rest and recovery. But I was so limited in my time with them, that oftentimes there was 2 or 3 people waiting while I was already with one patient. So I felt limited in that system. So once I learned more about what health optimization was and functional medicine and really optimizing someone's health, I sort of made the transition little by little by little. And it was, thanks to some of my colleagues that also made the transitions to more health optimization kind of medicine and longevity medicine.
So you're really making a difference before problems occur.
Yes, certainly. Now we do advanced early detection
Mm-hmm.
of illnesses much earlier than before.
Mm-hmm.
Very advanced biomarkers as well. And I also try to optimize people's metabolic markers. So things that are related to heart disease and stroke and cancer and diabetes. So those early metabolic biomarkers, the advanced diagnostic testing, pairing both of those and really coming up with targeted interventions for patients.
So you set up the plans to avoid those eventual problems.
Yes,
Very good.
I do.
Very
It
good.
takes a lot of digging and a lot of curating the patient's plan and really understanding their biology, their genetic predispositions, their family history, their current conditions, their lifestyle. So all of those really play a major role in wellness. Oftentimes people think that just by taking a supplement or having an IV that's the secret to wellness, but really wellness is so much more than that. And we'll probably get more into that.
Yes, absolutely. So, you mentioned about you want to be the Four Seasons of med spas. As we were talking before the interview, you come from a humble background. How do you make patients comfortable and make this type of medical practice affordable to the average family?
Yeah, great question. So I do come from a humble background, a background where I was, raised in a single parent family, and oftentimes struggled a lot with adversity. So I remember as a child, our home went into foreclosure, and we had to spend some time in a homeless shelter, and also stand in line to receive free boxes of food. So all of those things really, made it a huge impression on me. Right, I wanted to not only come out of that, but also aspire to something more and help others aspire to something more that maybe weren't as fortunate as everyone else. And so having that background was really instrumental and pivotal in my life. And I don't shy away from it. I like telling people about it. But just like I had that background, I also can appreciate beautiful environments, positive environments that support well-being, like the Four Seasons. They built their business on luxury and curated an experience from the moment you walk in to the moment you rest your head in their beautiful beds and comfortable linens, to the moment you go to breakfast and experience all of their programming. So all of that really is what helped me create Bodywell and curate it and be able to offer the services to our patients. We have packages, we offer promos. Oftentimes we run certain promotions where patients can come in for a free service or they get a free consultation. So we do make it accessible for patients and for our community, which is the community that really supports us.
No, I think that's so important. And it's so important for people to know that you're cognizant of those issues, because things are expensive these days, no matter what they are. So, but let's switch gears from price to science. I'm Googling all the time how to look younger, how to look better,
you look great,
how to lose weight with not stopping eating, all of those things. And but when somebody comes in feeling exhausted or not performing like they used to at a younger age, what does a full longevity evaluation look like when they come to you?
That is a really great topic that really is so near and dear to my heart, because oftentimes patients just base their wellness on their annual physical, right? They see their primary care doctor or their internist and say, well, you have a clean bill of health, nothing's wrong with you. But really, you have to go deeper than those baseline labs. I check levels of vitamins, minerals, which our food and our soil is depleted of minerals, as well as antioxidants, NAD levels, and these are all levels within the cell. So these are intracellular levels of all of these different nutrients. I also check your biologic age, your rate of aging, and the age of your organs. So I like to take a more comprehensive, advanced approach to when it comes to your biomarkers, right? And we track these over time. And with our interventions and our treatments, we're able to show patients, when you came to us, you actually were deficient in vitamin B6 or B2 or glutathione or vitamin C or alpha lipoic acid, many of these biomarkers that are measured within the cells. And now we've put together a treatment plan specifically for your deficiencies. You would be astonished by the improvements and the outcomes that people are experiencing just with running some simple diagnostics. And so patients see the value in that. We're not just guessing, oh yeah, you need B complex or you need an IV with B12. We actually take the time to do the diagnostics and really personalize the interventions for patients. And as you know, as we get older, our bodies become deficient in NAD and hormones. Our metabolism slows down. We're more susceptible to infections and frailty. So all of these things are important things to look at and to really take the time to treat.
Sure. Anyone my age knows all about that. So yes, I agree with you. And taking a multiple vitamin every day doesn't really cut it, does it? So your longevity panel, which I assume is what we're talking about with this, the testing that you do and the results that you get, is intense about you mentioned the micronutrients, the intracellular. What you mentioned NAD. What's NAD?
NAD is a cofactor that's found in every living cell of your body, and it is responsible and facilitates energy production. So it works directly on the mitochondria. Mitochondria are these little organs that exist within the cell. So their specific role of the mitochondria is to support your energy metabolism. So when it comes to the fuel that fuels your body is ATP, NAD is what supports the production of ATP.
Oh,
so
okay.
as we age, we know that NAD production declines with age. And so what we do at BodyWell is that we check your NAD levels, and oftentimes patients are either deficient, severely deficient, or suboptimal. So we try to get them in the green to the optimal range. And when we do, they have better energy, they have less brain fog, they're able to think more clearly, better physical performance, improved stamina, and it actually has been shown that optimal levels of NAD can reduce your risk of chronic illnesses like neurodegenerative disorders, cardiovascular disease, cancers, and arthritis, and many others.
Wow.
So optimizing your levels of NAD will make you feel good, but it's also good for you in the long term.
Wow, that's great. I can't wait to come to your office. This is good. You've talked about the testing that you do, and you've also mentioned to me that, you need a certain level of the testing, and that's a non-negotiable item with you for patients at your clinic. Tell us a little bit more about that.
Testing is so important because not one size fits all. Your biology and your lifestyle and the way you rest and what you eat is very different than someone else. And there's variations in every human body and every physiology. And so it really is important for me to have patients' results and curate a specific treatment plan for them. That's personalized, that's timed appropriately, and there's the frequency of their treatments are also appropriately spaced over time. And also retesting is important. Are you getting better? Are your levels of vitamins improving over time? So this is really what sets us apart from any other medical establishment, is that we take the time to look at your labs, to understand your lifestyle, to ask you questions about how you're, are you sleeping enough? Are you exercising? We know that exercise is the number one predictor to all-cause mortality. People that are more active have a 30 to 40% reduction in all-cause mortality, meaning that all diseases that are causing death, those get reduced with exercise. So we take the time to talk to patients about those really critical issues, like exercise, nutrition, and sleep.
Very good. And I assume set up plans for improvement.
And set of plans, absolutely.
Great. So we've talked about, I was reading about biological age versus chronological age. Clearly, it's talked about, it's a huge topic these days. How do you measure biological age, and what does that test show, and how can someone generally slow or even reverse that biological age?
That is the million-dollar question, and I think the medical community is slowly understanding that one step at a time. The test that we use is a test that was developed at Harvard and Yale, as well as Duke, and it's a DNA methylation test. So basically, it's a genetic study that looks at your DNA, and it looks at how many times your DNA has been tagged by methyl groups, which are carbon groups. And based on how much of that methylation has happened to your DNA, it assigns a biologic age to the patient, and it also assigns a biologic age to your organs. And so this is done at a lab, and we receive the results. And apart from that, it also gives you the rate of aging, so how fast you're aging. Anything under 1 is that you're aging slower than normal. Anything above 1 is that you're aging too fast. So all of these metrics are very important, and people want to know these things. They want to know, hey, am I living a life that's aging me too fast? Should I slow down? Should I drink less? Should I stop smoking? Should I sleep more? Should I pay more attention to exercise? And so all of these metrics really give us that understanding, and we're able to explain that to patients and curate plans for them. I don't know if I answered your question completely.
Well, my birthday was yesterday, so I'm keenly aware of my chronological age. So we're keenly aware of how do we reduce that biological age to something substantially less, or at least a year or two less.
Happy birthday!
Yes.
By the way.
Thank you very
Happy
much.
birthday.
I appreciate that. But I was given a scale that I stand on, and it tells me my body mass and all of that, and then it also gives you your biological age. Well, I assume that my scale isn't doing all the things that your testing does. So probably, a little bit of smoke and mirrors, but, they need to sell scales. But once again, another reason to come in and see you guys. We've talked DNA and methylation.
Methylation.
That's the testing that you do to come up with the biological age,
Yes.
correct? Yes. And all of those are great pre-screens for cancer and other problems, correct? And looking at how that may affect your body?
This test in particular is more for assigning your biologic age, your telomere length, your rate of aging. We do run a specialty test called the Gallery Multi-Cancer Screening Test, which is a blood test that really just needs 2 tubes of blood, and it checks and screens for 50 different kinds of cancers, including the top most lethal cancers like pancreatic cancer and colon cancer. It isn't 100%, if it's negative, then you don't have cancer, and it's not 100% if you're positive, then you do have cancer. But it is a great screening tool that's being adopted by major academic medical centers. So it is one that is validated, it's sensitive and specific. So it is something that we offer our patients that, may not have time to get a full body MRI, or may not have time to go to different specialists. But it is just a screening tool, and it's not the end all be all, but at least now we have something that allows us to detect cancer at an early stage and attack it early if it's there.
Very good, because cure is certainly based on early detection, or cure rates are much higher, right?
Yes.
So, I was drinking my protein shake this morning, and this protein shake that my partner bought now says it has peptides in it. I have 20 grams or 10 grams of peptides that I drank on the way here this morning. break it down. What the heck is a peptide, and why is it good that I just drank it? Or is that just smoke and mirrors, and it's another? We should be looking at it in a different way.
Marty, you're probably the billionth person that has asked me what peptides are.
There you
which
go.
is good because there's more awareness now of peptides. Peptides are a chain of amino acids, so basically amino acids that are connected by a peptide bond, they're connected, and they're less than 52. So they're between 2 and 52. Once they exceed 52 amino acids, then the molecule is considered a protein. So peptides are essentially a small protein. They're not long enough to be considered a protein, but they have the same chemical composition as a protein, just much shorter in their length. There are all kinds of peptides out there that are collagen peptides, there's signaling peptides, there's peptides that are approved by the FDA for different medical conditions. They serve different functions. So one of the oldest peptides that we know in medicine is insulin. Insulin is considered a peptide in the body that regulates glucose control and tells your organs when to take sugar from the bloodstream and absorb it. So when it comes to peptides, they're all over the athletic space and the performance space and the recovery space. But you really want to be careful because they're also all over the internet. You can order peptides on, every other website now. So if you are interested in peptide therapy, you should really work with a provider that knows peptide science and that knows protocols and whether or not you are a good candidate for peptides. Obviously, the peptides that we drink are going to help us with muscle and protein intake. So keep drinking your peptides.
Okay, great. Costco's going to be thrilled to hear that. But obviously there's a number of different kinds, and we need to know what that is and to follow that then. Once again, back to BodyWell.
Back to BodyWell.
Yes, okay, very good. Love it, love it. If I come to you as a patient, what should I be looking for on a timetable for treatment with your clinic? Is this something that is something I come in weekly? Do I come in once a year? Is this over a period of years? Tell us a little bit about what should be the patient experience with BodyWell.
The patient experience always starts with the consultation. I get to know you in the most traditional way of medicine, going over your medical background, any allergies that you have, any medications that you've been assigned to take, any surgical history. Very incredibly important is your family history, right? What you're predisposed to, and also toxins that you've been exposed to, or heavy metals. Really gathering all of this important medical information, doing a physical exam, and then also talking about your goals and your interests. What are you interested in accomplishing? Do you want to look better? Do you want to feel better? Do you want to live longer? Do you want to be able to walk more than
Okay.
you used to? Oftentimes we see patients that tell us, I used to be able to walk 5 miles. Now I can only walk half a mile, and I'm having trouble walking. I have pain in my body. I'm inflamed. And so it's really understanding the patient and where they are, what their baseline is. And once we do that and have their diagnostic workup, then we put together a plan that may include seeing them once a week initially, maybe twice a week, maybe once a month, or maybe quarterly once we stabilize them and we improve their health and they're feeling better. But generally, patients are with us for a long period of time. I think the longest, I've only lived in Miami for 5 years, but the longest standing patient that I have here in Miami, I would say is 3 years.
Mm-hmm.
She's followed me from when I worked in Aventura Hospital to now here in Miami Beach. So we do believe in continuity of care and really having a long-term relationships with our patients and with their families as well.
Sure. And when you're improving, you want to stay with you. So I can understand that. Doctors in Florida now can do stem cell treatments. I've had a friend that had to go to Canada to get a stem cell treatment for leukemia. What type of treatments can you do as a doctor in Florida with stem cell?
Very important point you bring up. As of July 1st of last year of 2025, the governor passed a law that allows physicians, both MDs and DO physicians, to offer stem cell treatments to their patients based on 3 qualifying conditions. The first being chronic pain, so patients that have been living with pain. The second being orthopedic conditions like osteoarthritis, bursitis, chondritis, things that are affecting your joints, or bones or muscles. And the third condition is impaired wound healing. So when you have wounds that are just not healing in the traditional sense or with traditional approaches. So under those three conditions, doctors can offer patients stem cell treatments.
Okay.
And just like your friend, I've had medical conditions where I've had to fly overseas for stem cells. Specifically, I suffered from a very severe form of bronchitis after having had COVID. My asthma converted to bronchitis, and I was on 3 different medications, and I was not functioning well. I was not speaking well. I was not exercising well. I wasn't breathing well. And really, it was interfering with my life on a both professional and on a personal level. And a friend of mine, Dr. Shapiro from New York, invited me to go overseas to get stem cells with her. And I said, well, tell me more. Is it going to work? Is it going to help me? How much is it? How do I get down there? She said, don't worry about it. I will get you in. You're going to come with me. And I said, okay, well, I'm willing to give it a shot. Why not? I've read so much about stem cells. I've attended conferences that are all about stem cells. And I was really tired of taking medication and not feeling better. So I've had my own personal experience with stem cells. After 3 treatments, I'm happy to report that I'm no longer on medication.
Wow,
and you
great.
can hear me speak properly. I can exercise now, and the inflammation in my lungs is gone.
Wow.
So
wonderful.
It is miraculous, and it's the frontier of medicine.
And do you think that will expand here in the States, or are we just too conservative?
Expand in other states of the country?
No, as far as expanding the use of stem cell treatment to other issues.
I hope it does, because there are several studies that have shown the use of umbilical cord stem cells, so stem cells from donated placenta and umbilical cord tissue, that have shown improvements and better outcomes in cases where patients have frailty, so older individuals that are fallen, that are weak, heart failure, rheumatoid arthritis, and osteoarthritis. So very, very common conditions that people struggle with as they get older. And these are publications that are available for everyone to look at.
Sure.
So I do hope, and I do believe that in the future we'll have more indications for stem cells. And there are several clinical trials currently undergoing in the U.S. That are ongoing, I should say. And I think in the very near future, patients will be able to experience the benefits of stem cells here in this country.
Well, that would be great. So,
Yeah.
well, we'll keep our fingers crossed. We can't leave our talk today without talking about GLP-1 medications. And whether it's Ozempic, Mounjaro, tirzepatide, all of those. How do you integrate these tools safely? And what do you tell patients when they're thinking about an injection, or now I read you can take a pill, and are they going to get fixed without a lifestyle change?
So we have patients that come to us very, very often that inquire about, the GLP-1s or the weight loss treatments. They are a novel medication. They're the first of its kind to work in 3 different ways to improve weight management. So they work at the level of the brain to reduce hunger and appetite, as we know. They work at the level of the pancreas to improve insulin function. And they work on gut motility so that when you're eating, you eat less, you feel full faster. And so this really attracts patients, because before, weight loss medications were all about speeding up your energy, lowering your metabolism, and almost they got you wired in a way. These medications don't do that. And so when I evaluate a patient, I make sure that that they have pre-existing conditions that may help and may be reversed when patients lose weight, like high blood pressure, like cholesterol, like diabetes, and pair that with their clinical presentation. Are they overweight? Do they need to improve their metabolism? And so really looking at the full picture and creating a plan for them is so important. Oftentimes, I start patients that are good candidates on the lowest dose. And I tell patients, it's not good to lose weight overnight. It's not good to lose 15, 20 pounds in 1 month. This is not good for you. It's not good for your skin. It's not good for your body. It's not good for your pancreas or your gallbladder. It really throws the body into shock. And so I counsel my patients that to lose weight over time in a more progressive and conservative fashion. And that allows me to also discuss lifestyle interventions like exercise, like diet and nutrition, like sleep, rest and recovery, mindfulness, social engagement, all the things that contribute to longevity and wellness. And so it's not a one solution to change your life. It's multifactorial. It involves many things to really achieve sustained and effective and safe weight loss.
If you mentioned about the speed of weight loss and how it affects your skin, and how well, I've certainly seen people that have taken this and they've lost a great deal of weight, and they end up with far more wrinkles and sagging skin, and at least the parts that I can see when they're clothed, and I don't know what it looks like without clothes, and probably don't want to see it. But how does the using a lower dose, and over time, does that help eliminate or reduce the amount of the sagging skin, or how you get more wrinkles in your face if you're not as full-faced as some of us are? Yes.
It does. Using lower doses over time in a more conservative way, it helps the body have more balanced weight loss. We know that your skin needs, to a certain degree, it needs fat cells. It needs lipids. And so when you lose weight too dramatically, your skin responds by losing collagen, losing that supple composition of the skin, and also it loses energy, right? Because most people some people that are losing weight stop eating protein, stop eating peptides and and collagen and protein shakes. So your skin needs all of those nutrients. It needs peptides. It needs proteins, and at a certain degree, it also needs fat and hormones. We know that that fat is where a lot of our reproductive hormones are stored, such as estrogen and testosterone and the others. And so oftentimes women that lose weight too dramatically, you can tell in their face because their face is depleted of fat now, meaning less hormones in their skin. So it's sort of multifactorial and it's pretty complex.
Yeah. So slow and steady is always better.
Slow and steady is always better. Absolutely.
There you go. A new phrase for us all to live by. For someone watching who's in their 30s, 40s, and 50s, give us 3 practical things that they can do this year to protect their health and their health span, so to speak, even if they never fly to Miami Beach to see you, which is a mistake, but maybe you won't fly. So what about for those people? Help them out.
Sure. So someone in their 30s, really laying a foundation of regular exercise is very important. I'm not telling you to go sign up for, the hottest gym or the most popular gym and pick up a personal trainer. Really just having natural, regular movement is very important. Walking, a brisk walk, but doing it consistently. And also we know that weight training is important as well. Resistance training, really putting that tension in your muscles and in your joints, not heavy, but it is important to really focus on muscle health and joint health. Okay. And so that's important when they're 30s. Rest and recovery is just as important as exercise. Sleeping adequately, allowing your body to regenerate when you're sleeping. We know that when you're sleeping, your growth hormone is at its maximum release. So growth hormone helps regenerate, rebuild, and heal the body as you're sleeping. So sleep is super important. So again, someone in their 30s, someone that thinks that, I have so many more years to live, well, you really need to lay a foundation of exercise, nutrition, and sleep.
Yeah.
Someone in their 40s, now we need to start thinking about more early detection. Are you experiencing less hormones? Are your hormones not balanced? Do you have any nutritional deficiencies? Do you need NAD supplementation? So really starting to look at these things. There's even talk now about early detection when it comes to prostate cancer, colon cancer, all of those, leading causes of cancer that both men and women seem to have later in life. And so 40s, detection, prevention, optimization, and then in your 50s, really everything that the 30-year-old is doing, everything that the 40-year-old is doing, and really start to take even more care of your health. Really being mindful, meditation, having deep social connections, being part of a community that supports you is super important. Avoiding loneliness is also important. Really being engaged with friends and family, because we know that that really is a huge contributor to health and longevity.
Oh, very good. And those of us who are in their 60s, buy the damn ticket and come to Miami Beach.
Come hang out with Marty and me.
There you go. Yeah, no, it's all good. I'm a business lawyer, and I help start businesses and help them grow. And building a business isn't easy. And establish it within a community takes real work, right?
It does.
And as you know, I chair the LGBTQ Chamber of Commerce in Miami-Dade County. You recently joined us, and we thank you for that. But from your perspective as an entrepreneur, why is being part of a chamber like ours so important to you and your business?
I think it's very, very important to be part of a chamber like the LGBT community chamber in Miami, because it is a nonprofit organization, and I believe that nonprofits have a vision and a mission to help and have community engagement and give back to the community. I also like to align myself with like-minded individuals that are professional, that are grounded in with the same mission and vision for our community. And so for me, it was very important that once we did open up Bodywell, that we would be active in the community and join the chambers and meet wonderful people like yourself, Marty. So thank you for accepting our application.
Well, we're happy to have you. And just for our viewers, the Greater Miami LGBTQ Chamber and Allied Chamber of Commerce is not just for the LGBTQ community, it's for the allies as well. So we're part of a much bigger community, and we're here to help people out. So it's great. And so I'm glad you're a part of it. You run this magnificent longevity clinic with a luxury feel. You came from your humble background, as we've mentioned. When you look back, what were the biggest risks that changed everything for you?
That's a loaded question, because
it's a gift I have. Yes, I know.
The biggest risk. Well, I think the biggest risk was really putting myself out there to people. Having come from a humble background, I didn't have a lot of mentors. I didn't have a father who was a doctor or an entrepreneur or an attorney or a business owner. So really putting myself out there and telling people, hey, I think I want to be a doctor, or I think I want to go to college, and there were people that said, I don't think you should do that. I don't think you could be, you're smart enough, or you come from the right background to be a doctor, or to go to college. And I think for me, that was the biggest risk, is telling people that. But there were those people that believed in what I was telling them, that said, there's something inside of you that there's potential in you. Mm-hmm. I remember my calculus teacher in high school. She would keep me so accountable to my homework, and she would say, this isn't good enough. Uh-huh. Why didn't you do the formula like this? And she was really, in my mind, it was one of the most pivotal moments in my career, when someone kept me accountable in that way and really believed in me, because there weren't many people around me that believed in me. Mm-hmm. And that is huge, right? Because if no one believes in you, how are you going to believe in yourself if you don't have that inspiration? So teachers, especially my calculus teacher, were pivotal and instrumental in my life. And I think the biggest risk was me telling people that I wanted to go to college and that I wanted to be a doctor. And looking back on it, it doesn't sound too risky in the traditional sense, like jumping off a cliff or jumping off of an airplane. It's not such a risk taker. But for me, as an adolescent with very few resources around me, very minimal support, I found it risky. I did find it risky telling people that, because I thought people were going to say, like, oh no, become a technician, or become an X-ray technician. Not that there's anything wrong with that, but that's what I thought people were going to tell me. And I felt that it was risky for me to come out, almost like come out and tell them, hey, I think I want to do this.
Right. Yeah.
Can I have a letter of recommendation? Do you believe in me? I want to apply to this program. I want to apply to college. Am I good enough for you to write me a letter of recommendation? So for me, that was a big risk.
And it kind of goes back to what we want to share on our program is that all of our backgrounds come to our aid somewhere along the way in our journey, but the importance of having a mentor and the importance for people to be mentors to others and to give back and to share and to be that calculus teacher for you who made all the difference in the world. I had a business law teacher in college that was so instrumental in me going to law school and me being very gung-ho about it. So it's those individuals that made the difference for us, and we can point those out. So those folks that are listening, hey, be a mentor too, right?
100%.
So now,
100%.
For doctors watching who felt stuck in this traditional sick care system, what are the first steps that they should take if they want to build a prevention-focused, regenerative, and longevity practice?
I think looking inside your own journey in medicine is important. And even maybe if you've had your own health challenges or family members or friends have had health challenges, whether it's cancer or a stroke or diabetes, really thinking about what you've been taught
Mm-hmm.
and thinking outside the box and really logically thinking, okay, well, we know that diabetes is related to insulin and poor glucose control. Well, logically, if you improve that, you may be able to reverse diabetes. If you lose weight, if you eat healthier, if you exercise, all of those are factors and elements that improve your metabolism, improve your health. And really think, by just giving someone a medication, is that really going to address all of those things that I just mentioned? No. You have to really counsel patients. You have to think of yourself not as just as a doctor that can write prescriptions, but also as a health coach and as a life coach for your patients. And really, when you start to understand that, you need to dig deeper. Think for yourself. Reach out to other physicians that have come to this conclusion and have this understanding. Join an organization, go to a conference, a wellness retreat, a longevity conference, or an anti-aging conference. That's kind of how my career started. I was collaborating with other doctors. I wanted to feel better myself. And so that's where my journey started. And that's the advice that I give to other young physicians is really focus on prevention, focus on nutrition, and focus on exercise.
Well, hopefully some of them are listening out there.
I hope so.
I know it's, I've been told by the sick care system physicians, well, patients aren't compliant. So in order to keep their cholesterol down or to keep their, their heart rate down and in the acceptable range, I need to give them medication. Well, but maybe if they were schooled a little more, they wouldn't have to be taking this medication and have all the side effects that may occur. So
most definitely.
Well, I think it's exciting what you're doing. And you're new or fairly new at Bodywell, 1-year anniversary. Where do you see Bodywell in the next 5 years?
Oh my gosh. It's such an exciting time. It really is. And we've put so much work this year into really building our practice and our brand because we do believe in community engagement and offering free events during the weekend. Like I mentioned earlier, we offer free yoga classes. We offer puppy adoption. We offer this month February we're going to be offering a conscious connection for our community for people that may be single or maybe out of a relationship and want to meet other people, not in the traditional speed dating sense, but more mindful, more conscious connections. So I personally believe that this is really what can really impact someone's health, those deep social connections, community. But to answer your question, where do I see Bodywell in the next 3 to 5 years? Well, certainly expanding, being able to create new Bodywells in different parts of South Florida that need this type of this type of support for the community, where patients can come in, people can come in, and from the moment they walk in, they're greeted, they're welcomed properly, they're offered water, alkaline water, and really where they make it sort of a wellness sanctuary for themselves, a home, where they're known by their first name, and where they don't have to wait 2 months for an appointment. Really making it accessible for everyone, not just like we mentioned earlier, the uber wealthy or the celebrities or the athletes, but really for everyone, because that's sort of where I came from. I was from from the everyone category, and now I have the opportunity really to work with everyone, which is such a privilege. I really learn. Everyone teaches me something every day. I learn something new from all of our patients and from all of our staff as well.
So do you see more locations for BodyWell?
I would like more locations for BodyWell. Certainly, yes, I do.
So do I need to connect you with commercial realtors at this point and other doctors? Okay,
yes,
well,
absolutely.
We'll do that because I think we need to spread the good news here.
And even internationally would be great. I do speak 3 languages. Many people may not know that, but I do speak Spanish and French.
Very nice.
So I would love to spend time abroad, and certainly in Scandinavia, where the Scandinavians know lots about wellness and how to be more mindful, and cold plunges and cryotherapy and fasting, all of the benefits of all of those therapies. So certainly there's many places that are opening wellness resorts, which is sort of a passion of mine. I like to travel with an intention, and many people these days are traveling for wellness purposes,
sure,
and for detoxification, and so that's sort of an interest that I have to work internationally with hotels and different wellness retreats.
Well, that's exciting. Finn and Nelson, I'm introducing you to Dr. Martin. You'll need to meet each other, friends from Norway. So I want to, we end every interview with a rapid fire. I'm going to ask you a question. Oof. You tell me the first thing that comes to your mind, and we'll go with that. One wellness myth you wish people would drop.
More is not always better, especially when it comes to sleep. So you want to sleep between 6 to 8 hours, because once you sleep beyond that, it's not good for your body. It interrupts your circadian rhythms and your REM sleep. So when it comes to sleep, also with other aspects of life, more is not always better.
Great. One daily habit that gives the biggest return on energy.
Movement. Movement is medicine. Whether you're going up and down the stairs, you're walking to the bus stop, you're walking from your car to the grocery store, you're walking on the beach, keep moving. Don't stop, because that's what's going to keep your lungs healthy, your heart healthy, your mind healthy, and your overall body healthy, and support longevity. So please, movement. So important.
Great. Okay.
Try to do it every day if possible. But yeah, that's the biggest advice I give.
Okay. Your favorite treatment to personally receive at BodyWell?
Oh my gosh. I received so many of them.
You got to tell me your favorite. Yeah, no, listen.
I like things that help me relax, that lower my blood pressure, that slow my thoughts, slow my breathing. So oftentimes I like our treatment chairs do recline, and they become very comfortable. So I do like to get our face lifting facial at BodyWell. We offer a facial that's about 45 minutes that has both manual massage, has microcurrent, and it also has lymphatic drainage. So that's a treatment that I like to get. I want to get it more often, but I'm often with patients. So that's one of my favorite treatments. It's just very relaxing. It's soothing. It reduces your stress. It reduces your blood pressure, heart rate, and all of that. As far as things that show results, my favorite treatment is microneedling with exosomes or with brightening serums. Why? Well, we all know that microneedling produces an abundance of collagen when done properly and when done frequently. And as we get older, the collagen in our skin and our body starts to decline. So when you do treatments like microneedling, which sounds scary, which is not, it's painless because we use a great numbing cream. you get a robust response from the body for tighter, more collagen-rich skin. So
Very good.
that is one of my
All right.
favorites.
Cool. The longevity and health expert you admire the most right now?
When it comes to longevity experts, I really look up to Dan Buettner. He is a National Geographic Fellow that identified the blue zones around the world where people have historically lived
the longest.
to 100 and beyond.
Right.
Places like Okinawa, Japan, Costa Rica, Sardinia, Loma Linda, California. These are places where people value social engagement, deep connections, living with intention and purpose, eating plants and beans, and also exercising naturally. You know, your sheep shepherds in Sardinia that go up and down with their sheep, the grandmothers in Okinawa that prepare food for their families and dance after dinner. You know, these harmonious environments that he discovered. And he discovered longevity in these places. And the remarkable thing is that he didn't discover longevity in a lab or in a medical institution or in medical school. He went to these
anthropology.
places.
Yes.
Yeah.
Okay.
He went to
good.
these places and really made a difference and brought that to life. And I really respect him for that.
Okay.
Although I am someone that believes in advanced diagnostic testing and improving metabolism and target interventions, I do respect and admire him as what he's contributed to the field of longevity.
Great. The most underrated lifestyle change for people in Miami Beach?
Balance. We think of balance as, I have to balance my food and I have to balance spirituality with professional, but Miami is known as a destination where people come to celebrate their wedding, or they come on vacation, or they come to experience the nightlife or the hotels or the beach. So oftentimes when I meet patients that are when I meet people that are visiting Miami, they think, oh, I could never live in Miami. There's always partying here and there's so much going on. It's just too fast paced and it's just party. And maybe for some people it's that way, but for a lot of other people, this is their home base, and it's important really to find balance.
Very good.
Yeah, really just find a life of balance when it comes to social engagements.
What's your biggest talent that people don't know you have?
Oh my gosh. Well, I do have a pretty good ability to dance.
Very good.
I can groove and I can get down, and maybe a little later I'll show you.
There you go. Wait till the party's at Bodywell, right?
Yes,
all right.
everyone's
Very
invited.
good. One thing you wish every patient understood before walking into any med spa?
When it comes to walking into a med spa, I think patients should know that you should come with an expectation of what is reality. There are patients who walk into med spas thinking that they're going to do one treatment, one little tweak, and all of a sudden they're going to look like a filter that they use on their phone, on their social media. They really need to ground their expectations to what one treatment can do, because oftentimes people need to do multiple treatments to really see the result or to feel the result when it comes to other therapies. But really having that expectation that is not a one and done.
Yeah.
That's never one and done. You will require maintenance either quarterly or yearly, depending on your age, and
or weekly. No.
Or weekly. But also, you may not even minimally invasive treatments may work well for you and they may give you the result that you want, but you also may be a surgical candidate for treatments. So there have been times where we've told our patients, really, I think the outcome that you're looking for, you're more suitable for a surgical intervention. And here is, a wonderful plastic surgeon that I would recommend. And they're very appreciative when we're honest, when we're honest and we're clear with them.
Yeah.
So.
Yeah. I was at the Fontainebleau during a plastic surgeons conference, and I was there with a friend of mine who is substantially younger than I am. And we're sitting next to this plastic surgeon, and he says to the plastic surgeon, "So what do you think? I've got these wrinkles by my eyes." And the plastic surgeon said, "Oh, you don't need surgery. Maybe just an injectable will take care of it." And so then I turned to him and said, So, Doc, what do you think about me? He said, full facelift. So, be careful what you ask for. Clearly hasn't happened yet. In one sentence, your definition of real longevity.
So real longevity, to answer your question, is really living,
Okay, I'm stopping you. It's in one sentence.
in one sentence. Oh my gosh.
Yeah, no, we got to be concise here because this could be your motto for the Wellness Center.
Adding years to your life, but adding quality to those years.
Ooh, that's very good.
Quality of life to those years.
That could be a great tagline for BodyWell. Dr. Martin, thank you so much for taking us behind the curtain of real longevity medicine. We appreciate that, beyond the trends, beyond the hacks, and into the realization of what your data, your diagnostics, and the kind of long-term thinking that actually changes lives. And for everyone watching who feels exhausted, overwhelmed, or older on the inside than what your birth certificate says, if you can find it, this is your reminder. Your biological age is not your destiny. With the right information, the right habits, the right partners, you can rewrite the way you age. I'm Marty Davis, and until next time, remember, the goal isn't just to live long, it's to live young. And keep compounding your health like interest so your biological age keeps dropping year after year after year. Thanks for being with us, and make certain that you watch us on YouTube and on wherever you see podcasts.